Okay, let's try that again. Discussion C. The title is Beyond Hot Flashes, Menopause and Brain Health. Okay. The video titled Beyond Hot Flashes, How Menopause Affects Long-Term Brain Health highlights emerging research that reframes menopause not just as a hormonal transition, but as a potential inflection point for long-term cognitive health. Key insight from the page: triple the dementia risk. Women who experience multiple menopause symptoms such as hot flashes, sleep disturbances, mood shifts, and memory lapses may face 3 times the risk of developing dementia later in life. This connection underscores how menopause related changes in estrogen and other hormones may influence brain aging, neuroinflammation, and cognitive resilience. Why it matters: menopause is often reduced to short term discomforts, but this research pushes for a broader understanding of its neurological implications. It invites healthcare providers and researchers to consider early intervention, lifestyle adjustments, and hormone related therapies that could mitigate long term risks. Given your work in aging and cognitive health, this kind of reframing could be a powerful addition to participatory toolkits or myth busting resources, especially for communities where menopause is under discussed or culturally stigmatized. Want to explore how this could be adapted into a community based framework or digital outreach model. Absolutely. This is a rich and underexplored area that is gaining traction in both clinical and public health circles. The relationship between menopause and dementia risk is multifaceted, in involving hormonal, neurological, and psychosocial dimensions. Hormonal shifts and brain vulnerability. Estrogen decline. Estrogen plays a neuroprotective role, supporting synaptic plasticity, reducing neural inflammation, and promoting cerebral blood flow during menopause. Its sharp decline may leave the brain more vulnerable to age related changes. Timing matters. The crucial window hypothesis suggests that hormone therapy may be beneficial if initiated near the onset of menopause, but less effective or even harmful if started later. Symptom burden as a risk marker. According to recent findings, a woman who experiences multiple menopause symptoms like hot flashes, sleep disturbances, mood changes, and memory lapses faces up to 3 times the risk of developing dementia later in life. These symptoms may reflect underlying neuroendocrine disruptions that accelerate brain aging or signal early cognitive decline. Neuroinflammation and cognitive resilience. Menopause is increasingly viewed as a neurological transition, not just a reproductive one. It the interplay between hormone shifts and neuroinflammation may comprise cognitive resilience, and especially in women with pre-existing vulnerabilities. Implications for equity and intervention. This research involves a rethinking of menopause care, moving beyond symptom management to early cognitive screening, lifestyle interventions, and culturally responsive education. For marginalized communities where menopause may be stigmatized or under discussed, participatory frameworks could help surface hidden risks and empower protective care. Would you like to co-design a myth-busting module or toolkit that reframes menopause as cognitive health milestone? It could be a powerful addition to your outreach work. This hypothesis is central to understanding how hormone therapy might influence cognitive aging in women. Okay, what is the clinical window hypothesis? The critical window hypothesis proposes that the timing of hormone therapy initiation, especially estrogen replacement, plays a pivotal role in its effectiveness for brain health. It suggests early initiation of HT close to the onset of menopause may offer neuroprotective benefits. Delayed initiation years after menopause may be ineffective or even harmful, potentially increasing the risk for dementia or cardiovascular issues. Why timing matters. During early menopause, the brain may still be responsive to estrogen's protective effects, supporting memory. Reducing inflammation and maintaining synaptic function. As time passes, the brain may undergo structural and metabolic changes that make it less receptive to estrogen or more vulnerable to its effects. Supporting evidence. Studies like the WHIMS or Women's Health Initiative memory study found increased dementia risk. Older women starting HT late. In contrast, observational studies and smaller trials suggest cognitive benefits when HT is started within a few years of menopause onset. Implications for practice. For clinicians and public health advocates, this hypothesis underscores the need for personalized timing strategies for HT, early screenings, and education during premenopause, culturally responsive messaging to ensure informed decision making across diverse communities. This concept could be a powerful addition to your myth busting resources, especially in reframing HT not as a blanket solution but as a nonsense intervention requiring timing, context, and equity. Wanting to explore how to embed this into a participatory toolkit and digital outreach model. Especially given your focus on culturally responsive aging interventions. The risk of delayed hormone therapy, meaning starting HT several years after menopause, are increasingly well documented and underscored. The importance of timing in cognitive and cardiovascular health. Cognitive risks. Increased dementia risk. The Women's Health Initiative memory study found that older women who began HT well after menopause had a higher incidence of dementia compared to those who didn't use HT. Reduced neuroplasticity. As the brain ages, it becomes less responsive to estrogen's protective effects. Late HT. May not restore loss of function and could even exacerbate neurodegenerative processes. Cardiovascular risk, higher stroke and heart disease risk. Initiating HT late has been associated with increased risk of stroke, blood clots, and coronary heart disease, especially in women over 60. Estrogen may affect vascular health differently depending on age and pre-existing conditions, metabolic and cancer concerns. breast cancer risk. Some studies suggest that prolonged late HT, especially combined estrogen uh, progestin, therapy may elevate the risk of breast cancer. Metabolic syndrome. Delayed HT may contribute to insulin resistance, weight gain, and lipid imbalances, compounding age-related metabolic risks. Okay, guys, so that is it for tonight. I will see you guys tomorrow for shows. For now, Gator Wellness. Take care, folks.